While fewer tests in the number of African countries is a top explanation for this particular trend, there is a serious concern that weak healthcare systems mean millions of Africans remain at risk. In East Africa, bring it closer, just in East Africa, Tanzania has the highest number of confirmed cases, but the government has been criticized for its lukewarm response to the outbreak. While Uganda and Kenya have since declared lockdowns and banned public gatherings, Tanzanian authorities only recently stopped international flights and in the latest efforts have declared 3 days of national prayer. Many are calling for more coordinated regional efforts if East Africa's curves are to flatten. In our conversation this morning, we're joined by Dr. Catherine Kobutunji, who is the Executive Director of the African Population and Health Research Center. Welcome to lockdowns and banned public gatherings. Welcome to Morning at NTV. Stopped international flights and in the latest efforts have declared. Good morning and welcome to NTV, Dr. Catherine. For more coordinated regional efforts if East Africa's curves are to flatten. Into the conversation, what do you make of the efforts of the East African states to deal with COVID-19 as of today, Wednesday, the 22nd of April, 2020? Welcome to
actually, the East African states are doing a decent job, if you ask me,
welcome to NTV, Dr. Catherine.
All projections and all indication was that Africa would literally be overrun by the coronavirus.
Into the conversation, what do you make of the efforts of the East African states to deal with COVID-19 as of today, Wednesday, the 22nd of April, 2020?
They are putting in place interventions at different times.
Well, we seem to just be having a bit of a technical error there, but just to get into it, we're having a conversation with Dr. Catherine Kobutunji, who is the Executive Director of the African Population and Health Research Center. Now we're getting to get her thoughts on what exactly, as an East African region, we can do to perhaps flatten the curve if we all come together collectively, because it's no longer just each state on their own, but because what thing that happens in one area could trickle down into another country as well. So let's just get back to the conversation with Dr. Catherine, if we can. Now, as we get into it, do know that we will be having tomorrow, the entire East African region will be having the 18th Extraordinary Summit of the East African Community. Now, this was called by the President of Rwanda, that is Paul Kagame, and it's set to be a virtual meeting. Now, it will deliberate on the regional response to the coronavirus pandemic. So, what do you hope will be at the forefront of the conversation is also something we are thinking. What should they do? Should they now come in and say, this is what was happening in Rwanda, this is what we've done in Uganda, this is what has been done in Kenya, and how can we perhaps pick from each other and how do we go forward? Well, that's what we hope. But for now, let's get back into the conversation with Dr. Catherine Kobutunji. Dr. Catherine, we apologize for that, but just to get back into your thoughts on what you make of the efforts by East African states to deal with the COVID-19.
Good morning, thanks for having me. As I was saying, the East African states are doing quite a decent job because by all indications and all projections, Africa was one of those regions that was supposed to be overrun by the COVID-19 outbreak. But from what we see, we're still hanging on. And as you've said in your introduction, countries are doing different things. They are mixing interventions. They're introducing them at different time points in the outbreak. And I think this is evidence. It is evident in the number of cases that are coming up in the different countries. Which country is doing a very good job, which one is doing an average job, and which country perhaps we need to watch because things might get out of hand.
Okay, well, let's now talk about strategy. Uganda was quick to lock down its borders. Kenya followed after that. But in Tanzania, one still gets the feeling that it's quite nearly business as usual. I mean, 3 days of national prayer now announced. But how important are regional efforts at this point in time? And stay away from just
if you look at the way the countries are responding, really they're following a script that has been provided by the African CDC that sort of stipulates each stage of the pandemic that the country is in and what to do at each of the different stages. So when you see what all the countries are doing, they're sort of following a script, but then of course there've been differential implementation of these different interventions. And that's where you see the differences within the countries. Now, the issue of the regional collaboration, I think it's something that is of concern because you would expect that at least even from the East African community perspective, there would be some kind of coordination around if country X it does a certain intervention, why wouldn't country Y think that this is relevant to them? And whether they would sort of have some kind of discussion and agree that this is something which is relevant. I think a good example is if you look at the interventions from Uganda. The first case in Uganda was from Dubai or the UAE. And immediately Uganda put UAE among the high-risk countries or the category 1 countries. And they even went ahead to try to find travelers that had come from UAE into the country and tried to track them. And actually, after that, a number of cases in Uganda were among those that were contacted as a result. The same did not happen in Kenya, the same did not happen in Tanzania, and yet you'd expect that those countries are actually getting the same stream of passengers from these countries, if not more. The second thing that you can see Uganda doing is they started testing truck drivers quite a while back, maybe at least more than 1 week ago. And these truck drivers are coming from Tanzania, they're coming from Kenya, and it's only 2 days ago that Kenya announced that they're also going to start testing truck drivers. So you see some kind of lack of coordination. I think you would expect that at this stage, the coordination would be better. There's better coordination at the bigger regional level. As I said, Africa CDC is actually guiding countries, and countries are following the guidance that has come out of Africa CDC. But then at the smaller sub-regional level, I think the coordination maybe could have been better.
Okay. Now, we still have a chance to perhaps reorganize that, because tomorrow the heads of state in the East African community are set to meet virtually. Now, what do you think should be at the forefront of their conversation? And what measures do you think they should perhaps take on?
I think what should be at the forefront of, I think, first of all, to get a grip on the pandemic itself. As I said, the countries are doing a decent job. In many other countries, if you look at Europe, at this stage of the epidemic, Uganda is in the 5th week, and Kenya and Tanzania and Rwanda are in the 6th week of the outbreak. Many countries are already in the thousands of cases. So the fact that we are still in the hundreds of cases, Uganda is less than 100, I think that's quite commendable. The only problem is that as time goes on, many countries are still grappling with these lockdowns cannot go on forever. So what do we need to do to actually ease the lockdown? Because once you ease the lockdown, then there's a danger that you get the second wave of infections. So even as countries try to streamline the kind of measures they're putting in place at this point in time to still keep the numbers under control, I think there are bigger conversations around how to open up the countries. And it doesn't make sense for Uganda to open up a country when, Tanzania, things are still getting out of control, or when Kenya does not yet have things under control. So beyond harmonizing some of the interventions that have to be implemented to keep the numbers down, I think there have to be wider conversations about how to deal with the post-lockdown period, because that's where things can actually get much worse than they already are.
Okay. Well, now, Doctor, taking a look at behavior, now one of the things is that the head of emergency operations at the World Health Organization in Africa cited people's behavioral change as the reason why we're yet to see the manifestation of worst-case scenarios. What are your comments on this, and how important is behavioral change at this point in time?
Behavior change is something that many times is left to the individual, but sometimes individuals behave because of the environment in which they are and because of the limits that the environment puts on them. So you can trust people to behave, but sometimes, you have to put in place an environment, whether it is regulatory, whether it is law enforcement, whether it is incentives for people to behave. So most people know what to do, but sometimes you need, government to come in to create the environment and the incentives or the disincentives for what people should do. So it's not enough to ask people to, for instance, self-isolate or to self-quarantine or to stay at home. That's when you put it out there, people know why it's important. So in terms of behavior change, it's important for people to know why they should do something. But then on top of that, you put measures to make sure that people actually practice, what they know. So behaviors at the individual level, it's important, but many times individual behavior can be influenced by the environment in which that individual, lives and operates.
Okay. Well, now taking a look at our healthcare system now, no government can say it was fully prepared for this at all, for this pandemic. But not even the United States was, where health workers are having to work without adequate protective gear. Bringing it to East Africa, what do East African countries have to do better? We were not prepared, but from what you have seen our East African countries doing, what do we have to do better when it comes to the healthcare systems?
I think from what we've seen from other parts of the world, there's no country which can treat its way out of this pandemic. No single country can afford to say we have a healthcare system that is going to help us control this pandemic. So I would advise the East African countries and my fellow East Africans that let's focus on keeping the numbers down, because if we get to 10,000 cases, estimates are that about 20% of cases become moderate or severe and they require hospitalization. So that would mean 2,000 COVID-19 cases alone. And that's the question of how fast are we getting to the 10,000 cases? We cannot shoot our way out of this pandemic. We cannot. We simply cannot afford it, because healthcare workers become exhausted. They are mentally stressed. We don't have enough of them. They start getting sick. So you can have total collapse of the healthcare system. And leaving alone the fact that the more cases that are out there, then the people have fear even to go for the basic, immunizations and family planning and for maternity care. So you have other, negative consequences of people fearing to access healthcare services. So what I would advise, let's focus on keeping the numbers down, follow what government is telling us, hand hygiene, respiratory hygiene, cough in your elbow, wash your hands, use hand sanitizer, stay at home. All these things are necessary, because there's no way our system can cope with the numbers, even in the thousands.
Okay. Now, lastly, before I let you go, Dr. Kobutunji, despite the grim times right now within the country and within East Africa and the entire continent, we find ourselves in a place where there might be a lesson we can learn. From earlier pandemics, we have learned something. What do you think might be the lasting lessons for all of us, all over the country, all over the East African region and the world?
I think for me, of course, I come from a research perspective, and one of the things which has been impressive is actually how African countries have managed to hang on and kept numbers down in spite of all the worst case scenario predictions that were out there. It doesn't mean we're out of the woods yet. We have to keep doing the right thing. But for me, it has been a lesson that Africa has experts, Africa has capacity, Africa knows what to do. And if this was a localized outbreak in Uganda, for instance, there would be hundreds, or if not thousands, of experts that would be coming in to tell us or to help us, figure out what to do. For me, the biggest lesson was that Africa can. You see it in the way academic institutions are responding. You see it in the way the society is responding. So I think after this, we need to question the self-doubt that we always have, and know that if we put our minds to something, we can actually do it, and we shouldn't wait for a pandemic, to keep that. Okay. We can and we should, not just in COVID-19, but even after this, that we really, really have a lot of African expertise and capacity, and we should never forget that. Okay. And we should never be made to feel that we can't, whether it is for malaria, whether it is for vaccines. I think for me that has been the greatest lesson.
Okay. Well, thank you so much, Dr. Catherine Kobutunji, for your time. She is the Executive Director of the African Population and Health Research Center. And from what she has said at the end of our conversation is that as Africa, we can. And this has also opened our eyes to the fact that as a continent, we can beat COVID-19 and can beat any other pandemic if we come